Sir, I'm Wayne Dennison. We haven't met. But let me ask you, let's start with what you finished with.
I'm sorry, one more time?
Let's start with what you finished with. You understand that the court was twice asked by Ms. Heard's counsel to order a medical exam of Mr. Depp, and those motions were denied.
I think your team told the court you didn't want to have them, and the court ruled on them, right? I don't think the court proactively did it. You kind of had a motion to them, right?
No. When Ms. Heard's lawyers moved for them and asked for them and did not get them. Isn't that right, sir?
If you're saying that's what happened, my understanding was that you all did not want him to undergo one. They petitioned for it. The court said no. Yes, that's what my understanding of it was.
The court said no to ordering Mr. Depp to do the medical exam.
Right, I said the court did not require it, right.
And there was one that was ordered, in fact, right?
There was...
All right.
All right, so the last thing you talked about was the Goldwater rule.
Yes, sir.
Been around for almost 50 years, right?
Yeah, I'm 59. That sounds about right.
Yeah. And it's been around as a result of a presidential election that you referenced.
Yes.
And who has that rule? What organization maintains that rule?
The American Psychiatric Association.
An association you're a member of?
Association that I'm a member of, yes.
Yeah. Aren't you a fellow or something?
Yes, I am.
Okay. So, and this is an ethical rule, right?
It is an ethical rule. And yes, it's ethical. They say rules. It's an ethical guideline. Yes, they're guidelines.
Mm-hmm. And you know that over time, the American Psychiatric Association has amended the rule, so it's not just about diagnoses, but it's also about professional opinions.
Could you be more specific, say, about professional opinion in regard to what?
Well, let me read this and see if you're familiar with it. It is unethical for a psychiatrist to offer a professional opinion about an individual based on publicly available information without conducting an examination. That's the rule, right?
If you're reading it directly, I will believe you.
Okay. However, a diagnosis is not required for an opinion to be professional. So my question is, it's not just diagnosis that this Goldwater rule applies to, it's professional opinions.
So again, I will reiterate that would come down to essentially nullifying witness testimony, expert witness testimony, without a direct evaluation. And as we know, it didn't happen. But regardless of that, the whole expert witness testimony thing would be basically rendered null and void.
The rule, in fact, contemplates that issue, doesn't it, sir?
Again, I'm just telling you the answer to the question. When you're reading me those statements, I'm telling you the response by the other side, who publishes also, is that if that was the case, there could be no expert witness testimony in the courtroom.
Psychiatrists are ethically prohibited from evaluating individuals without permission or other authorization, such as a court order. That's the rule, right?
Again, if you're reading that, then I have to believe you're not misrepresenting it. And I would come back to, again, then this whole thing on expert, we might as well get rid of all the expert witnesses we've had throughout all of time for court proceedings. Because what you're saying is unless a court orders it, and that's what you just said, or the APA said, then therefore expert witnesses cannot do an evaluation based on an observation of the medical records. Insurance companies cannot do evaluations solely based on the medical record where they're doctors rendering professional opinions. So at the end of the day, you are essentially saying that unless someone has directly evaluated it, This whole medical system we have, this whole legal system we have is null and void.
I'm not saying.
No, yes, you are, sir. No, you are.
Well, give me a second, and I'll give you more than a second. What I'm saying and what I am reading to you is a rule by your organization that takes into account that there could be court orders that would permit the exact kind of evaluation that you say I'm eliminating.
And I think we're going in circles because I think I just said that means expert witness testimony would not be allowed, and the branch of forensic psychiatry would be especially hindered. And we know the branch of forensic psychiatry does not prohibit that. So I am a member of the APA. That doesn't necessarily mean every single thing they put in there, everybody has to uncategorically agree with, because clearly that's not the case.
Did you agree in your deposition that the professional opinions you rendered were inconsistent with the Goldwater rule?
Yeah, my first was inconsistent. If we're saying that if the Goldwater rule says, and I very much said that during deposition, that the Goldwater rule was made for presidents and public figures such as that, but regardless of that, because that's what it was made for. It's not made for Hollywood, but I'll even take that Mr. Depp's a public figure. What I'm saying to you is that the Goldwater rules say we cannot do any expert witness testimony in our field. That is exactly what the Goldwater rule is saying based on exactly what you read. And I'm just telling you what you are saying that rule encompasses.
What I'm asking you, sir, is did you comply with the ethical requirements of the APA when rendering the professional opinions that you've rendered today?
It is a requirement of the APA. It is not the requirement of the APA. Secondarily,
so the answer is no?
Secondarily, again, in order to not, we wasted our whole morning because there was an expert witness before me. There's an expert witness everyone brought in. So all I'm saying to you, that means the whole field of medical legal law is corrupt and unethical for engaging in an act that the APA clearly says we should not do. So if you're saying that, then the answer is yes, I'm agreeing with that statement.
You're agreeing that the APA would deem your testimony and your professional opinions rendered unethical.
I'm saying you are saying that I'm an expert witness. I'm saying as an expert witness, and solely as an expert witness, that guideline is permitting that from occurring. I would say then that the whole field of expert witness testimony, again, would be disavowed by what you are quoting in the Goldwater rule. And we know that's not the case, because if it was, we would not be allowed to do it.
And you said the rule was for presidents, right? And
that was initially for presidents, yes.
Well, and the name of the rule came from that. But the rule says it is unethical for a psychiatrist to offer a professional opinion about an individual. That's right, sir. It's not just presidents, it's not public figures, it's individuals.
Funny, it was named after according to your logic, if you don't put something in the title, it's not true. That's what you told me this morning, I believe, at my intimate partner violence. So what I would say to you then, sir, is that if you say this about an individual, again, any court would have to render an expert witness testimony invalid. Any doctor that reviews charts would have to render it invalid. I can go on the list of docs that do not see or interview patients directly, and that's a violation. So basically, you are saying that unless you do a direct clinical evaluation, then all of the field of forensic psychiatry and all of managed care is doing an unethical violation because we are not seeing the presence. We deny patients medications all the time without seeing them. We deny patients treatments, unfortunately, without seeing them. And I'm on the receiving end of that. So the answer to your question, again, unless you are saying to me that all of this is unethical, which is what you are saying. This is how I'm interpreting what you are saying to me. That unless you do the evaluation directly yourself, Therefore, it cannot be considered ethical. And I'm telling you how that's applicable to not just expert law, but also managed care. It's applicable to multiple branches of medicine. Hospital duration of hospitalization stay, they get evaluated. So tell me where you want me to end this.
Well,
Sir.
why don't we talk about what you just testified to? Because I didn't ask you anything about that. I asked you whether, under this rubric, under this principle of medical ethics, have you acted unethically? Yes or no?
No. As an expert witness, I have not acted unethically. And if you want the jury to believe that expert witnesses are unethical, then I guess that's for them to decide.
Yes or
that's
no,
for them
sir.
to
You
decide.
said no. Let's go to the next question.
Okay.
Right? Psychiatric diagnosis occurs in the context of an evaluation based on thorough history-taking examination and, where applicable, collated or collateral information. You'll agree with that?
I believe I said that earlier, yes.
Yeah. And it's a departure from the methods of the profession to render an opinion without an examination and without conducting an evaluation in accordance with the standards of psychiatric practice, correct?
Well, again, by the way, for the record, intimate partner violence is not a psychiatric diagnosis. I'll start with that. Substance usage by themselves is not a psychiatric diagnosis. If you want to cut to the chase, psychiatry is not a diagnosis of that. Narcissistic personality traits is not a diagnosis. Ergo, I am basically commenting on the things that were brought to me, which are not diagnosis. But an evaluation, if I was going to treat a patient or anyone here, those are the steps I would take.
We, I think, started with the notion that this rule applies broader than diagnoses. It applies to professional opinions.
I believe you just
rendered
quoted
professional opinions relative to narcissistic personality traits, haven't you, sir? Relative to Mr. Depp.
Again, I believe you just commented on what it takes to do in a psychiatric evaluation to establish a diagnosis. I'm almost certain that's what you said. And maybe I'm wrong. Maybe you didn't say that, but I'm sure you did. And therefore, what I'm saying is neither IPV, nor substance usage, nor narcissistic personality traits a psychiatric diagnosis. And then under the rubric of expert witness testimony, you are saying I acted unethically under the rubric of expert witness testimony. So if you, sir, would like to proceed that expert witnesses are unethical, based on that, I am not going to sit here and disagree with you and waste everyone's time. I think it's fairly obvious. So thank you. Go ahead. These were your words. I'm just saying them back how they're interpreted.
Okay. Let's start with the easy question then. Maybe we can.
That was pretty easy. Go ahead.
All right, Doctor, you're going to have to just answer the questions.
Okay. Sorry about that. Getting into it.
You need to just answer the questions,
Okay.
Dr. Speaker.
You are not rendering any diagnosis whatsoever of Mr. Depp today or ever.
No, I probably would say to you that certainly I would not say narcissistic personality, or I would say traits. Certainly from what I have read, intimate partner violence is not a diagnosis. So the answer is no for that. Narcissistic personality traits is not a diagnosis. The answer is no. But if you want to tell me that substance use disorder is a psychiatric diagnosis, the answer is yes.
But that wasn't an issue, was it? Whether Mr. Depp used substances? I mean, you said you've gone through the record. That wasn't really an issue at this trial. He's said it from day one.
Oh, so you're saying he's already admitted to the diagnosis?
He's already admitted to the use of the substances.
Well, again, there's a difference between admitting to substance use and substance use disorder.
Let's go back to what you just said about narcissistic personality traits.
Yes.
Narcissistic personality disorder is a DSM-5 diagnosis, correct?
Correct.
Diagnostic personality, and you haven't testified that Mr. Depp has narcissistic personality disorder, have you?
I would certainly, if I didn't, I'm certainly thinking that, but at least I'm going to say he has traits which are characteristics of provisional diagnosis of, it's a provisional diagnosis of probably narcissistic personality disorder. But yeah, I mean, I do believe that.
Well, but when you say provisional diagnosis, you know the DSM-5 requires, in order to find that diagnosis, 5 of the 9 factors.
Mm-hmm.
And you haven't done that analysis. You've never made that diagnosis. You've just identified certain factors.
That are criteria for the diagnosis.
Right. But you need 5 of 9 to get to the diagnosis. You've already told us that you didn't make a diagnosis. You're just identifying traits, correct?
I'm identifying traits that are consistent with the diagnosis, yes.
Right. And did you testify in deposition that the existence of traits, as opposed to the disorder, doesn't have a correlation with IPV?
If I said traits do not have a correlation with the, if that's what I said, and I don't remember saying that, but that wouldn't be a correct saying. Narcissism has a correlation with the diagnosis. Yes, that part's true.
All right, how far are we going to back this up? Because there's a diagnosis of narcissistic personality disorder, right?
Yes, sir.
And that one is tied, has some correlation with IPV, right?
Narcissism has correlation with IPV. Again, you're not allowing me to answer. You're splitting hairs. You're splitting hairs between the traits that are consistent with, which all I'm commenting on is behaviors and traits that are consistent with the diagnosis. And Mr. Depp, narcissism absolutely has risk factors associated with IPV.
Let's go back again, and maybe we can focus on the question I ask you, and we can get an answer that's addressed to that question.
Mm-hmm.
Narcissistic personality disorder is a risk factor for IPV, yes or no?
Yes.
And you previously testified that there is no literature at which you are currently aware that the mere presence of narcissistic traits is a risk factor for IPV.
Am I answering the question?
Yes.
That's incorrect.
You didn't testify that.
Cluster B traits, which narcissistic personality disorder is part of, is a huge risk factor for intimate partner violence, which cluster B traits include narcissistic personality disorder, antisocial personality disorder, amongst others. So the answer to the question is every resource on intimate partner violence will support that cluster B traits, where narcissistic personality falls under, is a risk factor for intimate partner violence.
Any single trait is a risk factor for IPV.
Again, I will repeat, cluster B traits. I didn't say any trait. I said cluster. No, you said
Let me be more precise then.
Okay.
Any narcissistic trait in and of itself is a risk factor for IPV.
But you are mischaracterizing what I said. What I said, I'm pretty sure I said cluster. If you look at all the intimate partner violence literature, and it would behoove you to do so, you will see that cluster B traits, I didn't say narcissistic per se, cluster B traits, where narcissistic personality disorder is part of, are risk factors for intimate partner violence, part and parcel, uniformly true. And I'm not sure, the thing I don't understand is, I'm not sure why we're arguing psychiatry, because I'm telling you what it is.
Dr. Siegel, you just need to answer the questions.
Okay.
So you want to talk about cluster B, so let's do that for a minute. Borderline personality disorder is a risk factor for IPV.
As part of cluster B traits, yes.
Histrionic personality disorder is a risk factor for IPV.
Less so.
But
Less so. Less so. I mean,
cluster-
it's a risk factor, but less so, yes.
Yeah.
Less so. Significantly less so.
All right. So which traits under narcissistic, before I move on there, there's only been one diagnosis in court of personality disorders, correct?
I'm not sure who you're referring to. Are you referring to Mr. Depp, Ms. Hurt? Who? I'm not sure what you were talking about.
Do you understand that there was a medical examination done of Ms. Hurt?
Yes, I did.
Do you understand that the testimony was ultimately that Ms. Hurd suffers from 2 personality disorders?
Okay, so I'm just being specific. I just wanted to know if you're talking about Ms. Hurt or Mr. Depp. So that's all I was asking you.
Yes or no to my question?
Which was there's only one diagnosis of, Ms. Hurd was diagnosed with that.
Yeah, and both of the diagnoses are in cluster B, and both of them are risk factors for IPV.
But both those cluster B things are, I'm not allowed to comment on the testing, so therefore, all I can say is that cluster B traits, and I'll tell you what they are, and by the way, I testified this before, which was that, 1, I don't expect perfection from my victims. 2, absolutely there were cluster B traits Ms. Hurd had. Absolutely, Ms. Hurd had.
Given that you've testified to it before, let's move on to a new question.
Okay.
All right? You indicated in your opinion today that you thought, well, why don't we move a little differently? Are you a member of the American Medical Association?
No.
Okay, so you don't know what the ethical rule of the American Medical Association is relative to doing clinical diagnoses about individuals you've never talked to.
So you're saying in terms of doing expert witness evaluations, under that rubric, right?
I'm just asking you, do you know the AMA's rule?
You're saying the AMA's ruling under the rubric of not doing evaluation, some of you did not see, and I'm questioning, I'm asking, so you are talking about expert witness testimony?
No, I'm talking about, do you know the rule?
I'm not a member of the AMA, so I don't read the rubric.
We can move on, you don't know the rule. All right. You rendered an opinion about Mr. Depp's purported cognitive impairment.
Yes.
Yeah. What do you use as a baseline?
A baseline for processing speed?
Yeah, for analyzing Mr. Depp before you watched his deposition.
What do I use a baseline for that?
Yeah.
I mean, I guess my baseline would probably be how I've seen him interact in public. How I've seen him interact with others. I've seen him interact in media. I've seen him interact and his process speed is certainly not slow. I've seen him do commercials. His process speed was not slow.
At deposition, didn't you say that what you did was compare Mr. Depp's performance in lots of pirate movies against his deposition testimony here?
What I said was I've seen Mr. Depp do apology ads. I remember he did an apology ad with Bad Dog with no delay in process speed. I've seen him interact with the media regarding to that. I saw no delay in processing speed. All I'm saying.
Let me ask you about pirates, though. You compared pirates to the depositions given in this case.
Then I apologize for what I said. Then I misspoke.
You misspoke? You didn't make the comparison?
Right now, just a second ago? Just a second ago, I may have said that I misspoke. I apologize, I misspoke.
Okay. Because you know you can't compare pirates to sworn testimony, right?
Yes.
Okay.
But you can, but as an aside, you can judge someone's processing speed at any time. Like I'm judging yours right now, you're judging mine. We all judge processing speed as a baseline because of what we know about each other. And I would say your processing speed right now is not slow. So, I mean, we're judging processing speed. I'm just saying to you.
Yeah. But no, any of Mr. Depp's other portrayals in movies, did that affect your analysis of processing speed?
Only I've seen him interact on interviews, and that was it.
Right.
When he wasn't in movies.
Right. But Willy Wonka doesn't matter to you? You see him in that movie, Charlie and Chocolate Factory? Did you look at that one when you were comparing his processing speed?
Do I have to answer that question, Your Honor?
You have to answer questions. Yes, sir.
No, you'll be happy to know I didn't see Willy Wonka. I didn't see 21 Jump Street when it happened, or whatever it was about. No, I did not.
All right. you made a very kind admission, I think, early on in your deposition, that you're not claiming to be a better actor than Mr. Depp. That's correct, isn't it?
100%.
All right. But with respect to acting, you know that actors actually rehearse for their parts and work on the language, diction, timing of their dialogue as part of that rehearsal?
If you say that's, I'm not an actor, so I don't know what goes on. I can't tell you. I have no idea what goes on in acting.
Okay, but you don't know enough about acting to know whether actors rehearse?
Sir, I am not an expert in acting. I have no idea what an actor does.
Okay. During your deposition, what were the circumstances under which you decided to call Mr. Depp an idiot?
Under somebody call Mr. Depp an idiot?
Yeah, you called Mr. Depp an idiot in your deposition. Why?
Okay. So I think it was in the context. I think it was in the, you probably should read the context of it, because I think the context was, and I'm trying to think back, okay? And what I thought it was related to was if you're coming to some deposition, okay? And again, I'm thinking back, so you have it in front of you. I don't. So I'm thinking back where he's coming in from Europe for a deposition, video deposition that he gave, and he took it overnight the night before. And what I think I said was that if you're going to do a major thing to a trial that you're involved with, I think you'd be an idiot to come in the night before.
All right.
So I didn't call Mr. Depp an idiot. I certainly called that planning an idiot. I didn't call him an idiot.
So the words, so I mean he's an idiot, are mistranscribed?
No, I'm sure, again, if I said it in that, if you're just reading one line, one snippet, I'm sure it was in the context I just said. But again, you have it in front of you, I don't.
Yeah. Is idiot a professional opinion?
I wasn't rendering professional opinion.
Yeah.
No.
Is it a psychiatric opinion?
And that follows the Goldwater rule.
How does it follow the?
Well, you just said that I'm not rendering a professional opinion. I just said idiot. That's not a
No, so idiot is not a professional opinion? Mm-hmm. Is it your practice to describe people as idiots?
In my practice, no, I don't describe people my clinical cases as idiots or patients as idiots or victims as idiots. No, sir.
But you sat for a deposition in this case and described the plaintiff as an idiot, correct?
You gave me 9 hours of deposition, and if I said the word idiot, it was an idiot in planning. It wasn't making him an idiot. I don't know Mr. Depp's IQ. I don't know his overall functioning. So therefore, if I said it, it was an idiot in planning, which is what I meant to come across as.
All right. So you did say you don't know his overall functioning, but you made some testimony today as to some evaluations you made relative to his functioning. You would agree with me that it's probably a good idea to think about the questions that are asked you in a court proceeding before answering them.